Best man's speech in a day. He got legless and threw up over the bridesmaids. 15 years. I could have murdered her and been out on parole by now. Hey, query fractured neck of femur.
Have to go to coronary care.
No S1Q3T3.
Those aren't the only electrocardiographic signs of pulmonary embolism. There's also sinus tachycardia and right ventricular strain, both of which are present here. Heparinize her and arrange for a VQ scan as soon as possible.
OK, thanks, Claire.
Since when have housemen made referrals?
Phil felt the case required a more senior opinion. I was out of the hospital.
At a wedding, how romantic. I had to leave my clinic to do your job. I won't do it again.
Claire! I'm sorry I was absent. I think Phil did the right thing. Thank you for your help.
How's he doing?
BMI? His ECG looks like he's wiped out a lot of myocardium. We've had to start TPA. I was about to bleep Andrew. I didn't realise he was one of your patients.
It's not. It's my father. Dad?
Rajesh?
Now you are here, perhaps someone will tell us what's going on.
Mum, Dad's had a heart attack. He's on all the right treatment.
That doctor, he was in and out like a flash.
You know how busy the job is.
Well, aren't you going to have a look at your own father?
Mum, Dad's already in good hands. I don't want to
No
step on
one
him.
has seen him for over an hour, Rajesh. You must do your job.
Blood pressure's still 90/60.
Are we measuring urine output? Hello, Raj.
Andrew, I was...
Yeah, I understand.
Just,
I found crackles up to the mid-zones, yeah?
Yes.
Yeah. We'll start dobutamine, 5 mics per kilo per minute. Thanks. We're going to start something to give your heart a boost. It's a bit weak following the heart attack, okay?
Andrew, look, I'm
Raj,
sorry.
be a bit more tactful, eh?
Aren't you going to chat with your father? You have hardly spoken. I'll try telephoning Bindu again.
You must be,
Yes. How's work?
Oh, it's okay. I ought to get back to work.
Yes.
I'll be back later. Bye, Dad.
Yes, it's Patrick Garden, casualty. Hang on a minute, will you? So what do you go up to coronary for?
Nothing.
You've been skiving half the day. You know how busy we are here. There's that fractured neck of femur still waiting. I'm sorry. Well, take him up then.
Sorry to keep you, Winnie. I'm afraid you've broken your hip.
Oh, dear.
I'm going to ask our orthopaedic team to take a look at you. They're used to mending this sort of thing in young ladies like you.
Raj.
I'll be right back, Winnie.
Old boy just brought in on his last legs. We need a white coat to look at him before he pegs it. George Grady, 80 years old. Advanced CA of the larynx.
Hello, George. I'm Dr. Rajat. We'll do something about your distress straight away. Oxygen diamorphomaxilin. Keep him comfortable. James. Carcinoma of the larynx diagnosed 5 years ago. Surgery, radiotherapy, now terminal.
I don't think it'd be kind to do anything heroic, this chap.
Not for 222. Agreed with the patient.
If he doesn't want resuscitating, I'm not going to stand in his way, you?
Me neither. Let him go in peace.
What's coronary care want you for? If you're busy, I'll take over here.
Yeah, thanks. Dad, the new treatment's working. Soon you'll be out of danger.
Thank you very much, Rajesh.
I can't place that bloke.
Maybe you worked with him somewhere before.
Please contact casualty. Must have. How's the punter with the CA larynx?
Comfortable.
Not a nice way to go, is it? Are you okay, James?
Fine.
I just wondered. Hello, Dr. Raja. Thanks for getting back to me. Yeah, I've got a 500-year-old lady with a broken hip. No past medical, Sorry, just one moment, please. Yeah?
Mr. Grady's passed away. You couldn't certify on one of you two, could you?
Sure. Ken, could you do a quick chest X-ray for me, please?
Sure. What is the patient?
Standing right in front of you, actually. I'd like your opinion on this.
Is this you?
Yeah.
I think you have pneumocystis pneumonia.
Yeah, I thought so.
Would you like me to contact the HIV unit at the General?
I don't know.
Winnie? You're not still here, are you, Winnie? Winnie? Winnie?
Dr. Roger, Chesham's Garden.
So, you suspect foul play?
I think someone must have deliberately overdosed her, yes.
There are no other possible causes of death, then?
Oh, well, yes, there are.
Have you noticed anything suspicious?
Not that I can think of, Mr. Tennant.
You may confer with your consultant. But I would like to proceed as per any medically unexplained death, i.e. post-mortem. Dr. Raja, you have something of a reputation for being one of our less serious-minded doctors. I sincerely hope this isn't one of your ill-judged pranks.
Caroline.
I'm pregnant.
When will Rajesh settle down, he asks. When will he show some ambition? And I have to say, I don't know. You are such a disappointment to him. You disappoint everyone who cares for you.
James, do you think I'm a failure? See that dog over there, licking its nads without a care in the world? Do you think he's worrying about his career prospects as a dog? Sometimes maybe a thing's not complete unless there's a part missing. I want to ask you something. If I get really sick, I don't want to be left to fester. Do you understand what I'm asking you to agree to?